Breath. Drop your head and slide out. Perfect.
There it is.
Yeah, it feels good. Yeah. That was loud too.
That was loud too. Yeah.
Wow. That was crazy.
That was a ride.
Yeah. Oh wow. I feel a lot less, stiff already.
Already, right?
Yeah.
Not too bad?
Mm.
Yeah. Hey guys, Dr. Clerge, a DMV chiropractor, and I'm here today with Tanisha. Right, okay. So Tanisha, you've been to chiropractors before, right? So you're familiar with chiropractic care for the most part. So what's going on? Stiffness, soreness?
Yeah.
Neck, upper, lower back?
My back.
Your back, okay. Mid, lower back. What about the upper portion? Any stiffness up there too?
Yeah.
Yeah, so pretty much the whole thing.
Yeah.
Okay. So you've been adjusted before, and how did it go for you?
Pretty well.
Pretty well?
I felt like a different person sometimes when I walked out. Like when I was walking after that.
Right, right.
Feel different, more loose. Like
Right.
just, I don't know how to, not as in pain.
Better range of motion.
Yeah,
better
I guess
movement.
that would be,
Right.
what I'd say.
Okay, okay. So we'll assess your movements, we'll see how you're moving, and we'll do some palpation, see what's what. And then at that point, we'll start the treatment, okay? All right. So let me have you face down first. All right, so pressure. How's that? Is that okay?
Yeah, it's sore,
All that is sore?
Yeah.
Right in here, yeah.
Yep.
Okay. Soreness as well in that area, or not too bad?
Not as bad.
Not as bad as up top, right?
Yeah, it's really like
really sharp up
yeah.
top. Okay, so we're gonna keep going down. How's that? That's okay?
Normal.
Normal?
Feels definitely sore.
That's a bit sore.
Definitely sore.
Definitely
really,
sore.
really sore.
Really, really sore. Okay.
Yeah.
I got you. So now I'm gonna apply that pressure, and I'm gonna keep the pressure, and I'm gonna have you take your whole leg and lift it off the table for me. Okay? Are you ready?
Mm-hmm.
Go ahead and lift the whole leg off the table and bring it down. How's that?
It definitely feels something.
You feel
like some soreness.
You had to labor basically to do it, right?
Yeah.
Okay.
It's not easy.
It's not easy. Let's do the same thing on this side. Lift the whole leg off the table for me.
Yeah.
Yeah, that's uncomfortable as well. Okay. All right, and apply pressure to the spine. How's that?
Sore down low, but it's not really.
Not as bad as when I press on the muscle, right?
Yeah.
Okay. That's okay?
Yep.
That's fine. Yep. Okay. Let's have you go ahead and stand up for me. Let's check your lumbar range of motion.
Okay.
Good. So we'll have you bend, try and touch both feet. Let's see how far you go. That's actually pretty good. Any pain with that?
Yes, it's really tight.
Tight. Hamstrings?
Tight. Yeah.
Okay, gotcha. Let me have you go ahead and move up for me. Good. We're gonna bring both arms up, and you're going to go back and extend. There you go. Let me know at what point you start feeling uncomfortable. That area right here?
Yeah.
Okay, gotcha.
I think it cracked.
You hear the pop with that? All right. Let's have you face this direction for me.
Okay.
Both arms up like this. You're going to rotate to the right and rotate to the left. Let me know how you feel with that.
I think something else might have cracked. It's
so
really
popping
tight
already. So
but you remember when I told you it's really tight, like on this side, and it's not as tight.
It's tight on that side. Gotcha.
Really tight right there, though.
Okay. Now we're going to let's do this motion. And then the other side. Right. How's that?
Tight.
Tight. Let's do that again. I just want to see your range.
Okay.
Okay. Good. Tight.
Tight.
Okay. Have a seat.
Okay.
All right. So now let's check your head and neck range of motion.
Okay.
So let me have you look down for me, and let me know how does that feel.
Fine.
That's fine.
Mm-hmm.
Okay. So let's have you extend. Let's have you look up, and go as far back as you can. And how does that feel?
It's okay.
That's okay.
Mm-hmm.
All right. Now we're gonna have you rotate. So to the right. How's that?
A little tight.
A little tight with that motion. Let's go to this side. How's that?
It's tight.
That's tight.
Mm-hmm.
Okay. Now we're gonna go side to side. Okay.
Okay.
So let's go to the right side. How's that?
I don't think I can go any further.
You can't go any
No,
further.
I don't think so.
Yeah, I got you. All right, so some tightness on that side as well. So let's go to the other side. How does
Really
that?
tight.
Really
I can feel my muscles
You can
stretching.
feel your muscles firing. Okay. You're gonna apply a little bit of pressure. That's okay.
Yeah.
Rotate, pressure. That's okay. And pressure. That's okay. All right. Okay. So a lot of muscle soreness, tightness.
Yeah.
In that range, especially the neck.
Yeah.
Cervical range of motion. A bit limited, not painful, but it creates tightness. Okay. Surprisingly, your lower back wasn't too bad because
Yeah,
you were able
really
to bend.
sore.
Right. It's
Really
so it's muscle,
sore.
if anything.
Yeah.
But we'll do massage at the end to kind of target that. Okay. But you're able to go,
Yeah.
move to forward flexion, almost touching the floor, which was pretty
I want
good.
cheese little ones. Yeah.
So that's not too bad. Okay. So we'll do the adjustments. I'll focus on the mid back, upper, and the cervical area for the adjustments. And then for the lower back, we'll focus on massages, okay. For that area.
Yeah.
But we'll massage the whole thing, neck, upper, lower back as well.
Oh, okay.
Okay? But we'll start with stretches first.
Okay.
So you're going to come down on your knees just like this. You're going to make your glutes touch your heels. They don't leave. Now, if it's easier for you to cross your feet like this, you can. It just depends. Some people find this easier, some find this easier. So whatever comfortable for you, just rock with that. So what we're going to do is glutes to heels. You're going to apply your hands down to the floor like this and make sure that your elbows stay locked. Perfect. You're going to drop your head down. You're going to take a big deep breath. And you're going to slide out. Continue to drop your head down as you're going up the whole time. Good. So you don't want to go straight out. Go ahead and start just like that. And then slide down. So slowly do it. As you're sliding out, you want to continue to, drop your head down at the same time. Perfect. So hold that. Keep the head down. And then slide back up. You should feel that all in here. How was that?
It was okay.
Okay. We're going to do it 2 more times.
I think I'm too short to do it that way.
Okay. However is comfortable. All right. Big deep breath. Drop your head down and slide out. Perfect. Great. Hold it just like that. Come back up. And remember to take your breaths, okay? Because a lot of people, they'll be worrying about the stretch and then they forget to breathe. I don't want you to pass out. Okay, we're going to do it one more time. Big deep breath. Drop your head and slide out. Perfect. Hold it there for a second. We're going to hold it a little bit longer. Perfect. And then come back up. How's that?
Feels good.
Good.
My shoulders stretch.
Go ahead and stand up for me. And this one's going to be for your back, okay? So what you're going to do is you're going to place one hand on your hip just like this. You're going to extend one arm all the way up. Big deep breath. And stretch it, let it out. Just like that. Good. So I'm going to assist a little bit. Big deep breath. And let it out. How's that?
Okay.
Hold it for a little bit. Good. Now let's come back. Switch that side. Perfect. And let it out. Good. Are you comfortable? Good. Let's go ahead and switch back. Big deep breath. And let it out. No, other way. Perfect. Come back and do it again on the other side. Big deep breath. Gotcha. And stretch and let it out. Perfect. Good. And you should have felt that all up in your back, correct?
I felt
Good.
it.
Good, now let's go over to the ball. Over here. There we go. Big deep breath for me. And relax and let it out. How's that feel?
Definitely feel the stretch.
Good. Can I go a little further? A little bit?
Well, you can try.
How about that?
Yeah, definitely stretching.
Okay. All right, let's switch to the other side. Same thing. Big deep breath. And relax and let it out. Good. We're going to switch back to the other side. So you don't want to move your head. You want to let me do everything for you, okay? Great. Big deep breath. And relax and let it out. Good. One more time on the other side. Big deep breath. And relax and let it out. Perfect. Great. So now you can sit your head up straight. What I'm going to do is rotate slightly like this. You're going to take a deep breath again. And relax and let it out. Good. Is that comfortable? Okay. Come back up. Rotate to the right. Big deep breath. And let it out. Good. Rotate. Big deep breath. And let it out. Perfect. One more time to the right. Rotate. Big deep breath. And let it out. Good. Perfect. Now we're going to work on some stretches for your back, okay? What I'm going to have you do is twist, and you're going to grab into the bars just like this. Yep, perfect. You're going to go ahead and twist yourself a little bit. Great. I'm going to come behind you and just apply a little bit more pressure like that. Before you turn, you want to take that big deep breath, and then as I'm stretching you, let it out, okay?
Okay.
All right, so we're going to start from the beginning. Great. Turn out, big deep breath, and let it out. Perfect. How's that feel?
Good.
Try to sit up straight. Yep,
Okay.
just like that. Perfect. Now you should feel it a little bit more, right? Good. Remember to keep breathing, okay? Go ahead and turn out.
Okay.
Big deep breath. And let it out. Good. Perfect. Let's switch back.
This one.
Big deep breath. Relax and let it out. Perfect. We're going to do one more time on the right, okay? Breath. And let it out. Good. Perfect.
The stretches went pretty well for the most part. Were you tight?
Yeah.
Tighter than you
My
expected?
neck, definitely.
The neck area? Right, yeah. Okay, so let's take a look. I'm going to do some motions with you first, okay?
Okay.
So I'm going to have you rotate to the left for me. Okay, good. And let's have you rotate to the right. Some tightness was there?
Mm-hmm.
Yeah, okay. All right. So, first adjustment, actually, I will go ahead and adjust the lumbar and then we'll move up, okay?
Okay.
So I'm going to have you on your side facing this wall for me.
Okay.
All right, square your shoulder up. Good. Drop your head in that groove for me. You're gonna hold onto your arm like this. You're gonna straighten this leg out. Good. And this time I'm gonna actually reach in, okay?
Okay.
Good. I'm gonna stabilize your thoracics like this.
Yeah.
Let's bend this leg. Good. All right. So I'm gonna pop each your lumbars.
Okay.
Take a deep breath. Let it out for me. Deep breath. Let it out. Relax. There. There it is. Yes, ma'am. That was pretty loud.
Yeah, it was.
Was that painful?
No.
No? Okay, come on. Good. All right. That's good. Okay. Good. All right, so now we're going to move to the lower thoracic region, okay? Mid and lower thoracic, okay?
Okay.
Let me have you extend and go back for me. Good. Go forward for me a bit. Okay. Now, what you're going to do, put both feet on the table. And I'm going to have you slide forward for me just a little bit. Perfect, right there. Good. So I'm focusing on this area right here, okay?
Okay.
So let's have both arms, bring them up. You're going to put your hands behind your head, go underneath your hair,
Okay.
and interlock your fingers.
Okay.
All right. And I'm going to reach in.
Mm-hmm.
So you probably have never had this adjustment before.
No.
And you're going to just lean back on me, okay? Good. There you go. All right, so what you want to do is keep your fingers interlocked. Good. Take a deep breath. Let it out. Good. So when you take that deep breath, when you let it out, you want to relax your body, okay? You ready? One more time. Deep breath. Out. Relax your whole body at the end of that breath, okay? Deep breath. Let it out. Relax. There it is. Yes, ma'am.
Wow. That was crazy.
That was a ride.
Yeah. Oh wow. I feel a lot less, stiff already.
Already, right?
Yeah.
That's Not too bad?
Mm.
Yeah. It's a little different.
I heard it. I definitely
we all
heard it.
Yeah, we all
Yeah,
heard it.
but I don't mind that noise. I was just like, wow.
Mm-hmm. Any pain?
No.
No pain.
Mm.
Perfect. Okay. So what I want you to do is just relax. Relax. Relax, relax. There it is. Yes, ma'am.
Mm. Yeah. That was loud too.
That was loud too. Yeah. Not too bad?
No.
Okay, good. All right. So let's try and get some movements on the other side as well, okay?
Okay.
So I'm just gonna pull your hair out the way.
Mm-hmm.
Okay. So what I want you to do
Mm-hmm.
is just relax for me.
Okay.
Good. Relax. Relax, relax. There it is. Yes, ma'am. How was that?
Yeah, it feels good.
No pain, right?
No.
Perfect. Let's have you go ahead and sit up. All right. So you're moving all over the place.
Yeah.
How do you feel so far?
Better?
Better?
I think so. Yeah.
I'll have you do the range of motion once we're done with all the adjustments.
Mhm.
So I have one more to do, okay?
Okay.
So we did the lumbars.
Mm-hmm.
We did your thoracic, okay? We did the upper thoracic. So that last adjustment was for the upper
Yeah.
thoracic, lower cervicals. I want to focus on the upper portion, right up
Mhm.
here. Occiput, C1, C2. All right, so I'm going to get on top of the table for this one, okay?
Okay.
Okay, so you can move back for me a little bit. And then move about an inch this way, just slightly. There you go, perfect. Now, I'm going to contact your occiput,
Okay.
right where my fingers are, okay? And I'm going to put you into some slight rotation. Drop your head in the palm of my hand. Good. All right. Yeah, I want you to just relax. Let your whole body go for me. Relax, relax. There it is. Is that painful?
Mm-mm.
How do you feel overall?
Better.
Better?
Yeah.
Okay. Get up, move around. Let me know how you feel.
Good.
Good?
Yeah.
Let's have you bend and let's see how that goes.
Okay.
That's actually that was actually good to begin with, but how does it feel now?
Not as tight.
Not as tight, right? Especially the hamstrings, right? 'Cause
Yeah, that was really tight.
that was really tight at first, right?
Yeah.
Okay, so arms up, rotate, move your head and neck around. Let me know how you feel overall.
Looser.
Loose, right?
In my neck, yeah.
Yeah. So you're able to move because
Yeah.
that lateral flexion was a bit uncomfortable
Yeah,
at first.
it was.
Yeah, and it's not too bad.
Mm.
Okay. So what we're going to do next, we're going to focus on the cervical.
Mhm.
So we're going to do massage for this area,
Mhm.
upper, mid, and then the lower back.
Okay.
All right.
How's that?
Good. Real good.
And when you say lower, do you mean here?
Yeah.
Okay. Just all over? I'll go all over. Don't worry about it. Does it tickle? Sorry. I see you like twitching it. It feels good though, right?
Yeah.
Yeah.